Hello, everyone. Welcome to another virtual activity with the CTE Foundation. Today, we are here to explore careers in nursing, specifically with a couple of folks from AccentCare. Now, before we start to get into all that, I do want to just kind of touch on what a nurse is. I mean, being a nurse is a bit more than a job. It's a choice to dedicate your life to helping others when they are in need. And you have to be smart, you have to be driven, you have to be empathetic, and your patients have to trust you. And today we have two people who have chosen that as their path. So I would like to introduce Wendy Matthews, Executive Director of AccentCare, and Joy Bowden, Director of Patient Care Services. Welcome, both of you.
Thank you.
Thank you.
Glad to be here.
So I want to start it out with just a question for you, Wendy, as the Executive Director. Can you just talk about what AccentCare is and also kind of what you do as the Executive Director there?
Yeah, thank you. AccentCare is a provider of home health services. We provide skilled services, physical therapy, nursing, occupational therapy, speech therapy, social worker, and we happen to provide behavioral health services as well to patients in their homes, which means our clinicians visit the members of our community that reside in their homes that are needing additional care, whether it be when they get out of the hospital, from a rehabilitation or a skilled nursing facility, or even if a doctor just sees a patient in their home and decides that there's some type of disease process or needs that we would be able to assist them with while they're able to remain in home. Mm-hmm. I'm the executive director. I am a nurse. By my degree. I did many, many years working in other areas of nursing prior to coming to home health and then joining AccentCare. I've been here about 10 years and I do both operations, meaning like kind of the financial aspects of the agencies, as well as helping to oversee clinical regulations. Joy actually does most of our clinical and regulatory compliance end, and I do more of the financial.
Well, on that topic, Joy, would you mind talking about your Director of Patient Care Services job and what you do there?
Yeah, absolutely. So just like Wendy, I started my career in nursing in lots of areas and fell into home health and loved it. And as my job as Director of Patient Care Services, help to work with the clinical aspects, our patients' plan of care, quality assurance, and then making sure that we have the right staff and making sure that the clients receive the care that they need with regulation.
Mm-hmm. Well, thank you both. I think that helps. I also have a video from AccentCare that I figured we could play. It's pretty short, less than a couple minutes, but it gives a pretty darn good overview, I think, for those who are really kind of just wanting to wrap their heads around AccentCare and the services that you provide. So I'm going to share my screen here and we are going to watch a video.
AccentCare provides highly trained and dedicated caregivers, serving patients and families across the country with a wide range of compassionate, quality care options in the comfort of their own homes.
Our team is comprised of care partners, nurses, therapists who have both the training and the experience to provide these services for our patients. They love what they do and it just shows. Our overall goal is an integrated solution of population and health management for our patients so they stay home, we keep them at home, they age in place and they age well.
Our licensed clinical and medical social workers can make referrals to community resources and help coordinate the details necessary for families to make the best choices to ensure their loved ones' safety and comfort. Being in the comfort of familiar surroundings speeds healing. So whether it's recovering from an illness or injury or transitioning from a professional medical facility to home, AccentCare's home health team will help ensure the process is as smooth as possible.
We at AccentCare feel that our approach should be one that's holistic. We look at all of the patient's needs and we assess where they are in the continuum of care. We can provide personal care services, all the way through end-of-life services.
You can trust the provider that thousands of patients and families depend on each day for compassionate, quality care in the comfort of home. For more information or to schedule an information visit today, contact AccentCare.
Great. So I wanted to play that video because just, at least for me, I think it gives a really good understanding of what AccentCare does, but they also touch on a lot of the things that we started talking about at the beginning, which is that that care, that empathy for the patient. And I think that is really what is at the heart of, it sounds like, you know, at the heart of what it is to be a nurse. But I do have a question about nursing careers in general. There are a handful of different types of nurses, and they all require some different level of education. And so I'm hoping one of you, either of you, could speak just broadly about the differences between the different types of nursing careers.
Of course, of course.
Thank you.
So here within AccentCare, we do use a multi-level approach to providing care services. So we work with a care management team per se. So when we're talking about nursing, we're looking at coupling an LVN, which is a licensed vocational nurse, or in some states they have different titles, but that's basically what we're looking at. Those are coupled with a registered nurse who is looked at as our care manager for the case. So the LVN reports directly to the RN, and together they provide a combination of services within their scope of practice for any given patient. Joy, would you like to expand on that at all?
And then I guess the expansion beyond that would be then our clinical supervisors who then supervise the field staff that would need maybe more skill set or more time in their career to be able to do that, and then coming up to the DCPS and the ED position with your nursing careers.
In California, home health requires 1 year of acute or inpatient type of previous service prior to really being eligible to be in a home health field. And that's because when we're providing care for our patients out there, we don't have a whole team of people in the patient's home like they do in a facility. So really, providing home health for a patient allows you to use your experience and your skills and your background and take that into the patient's home, which also requires that you have really good, comfortable, solid assessment skills, teaching, training, education, really feeling like you have the skill set to be able to manage all of those disease processes that we see as a nurse in the home, whether it be diabetes or congestive heart failure or a wound or an IV or medication management. Here in this arena, even though we have a huge support group from the office and other clinicians in the field, when you're with that patient, it's really a one-on-one situation, which I think a lot of nurses like, because when we went into nursing, we kind of felt like the reason we are doing this is because we want to be able to make a positive impact in our patients' lives, allowing them to be independent as long as possible, allowing them to stay at home, really helping them to manage and learn how to take care of themselves. And in home health, that's really what we do.
Mm-hmm. Well, that actually kind of leads me to another question that I had, which is where the difference is between, say, a nurse in a hospital and a nurse in a home. And you sort of touched on it, right? It sounds like a nurse in a medical center of some sort is really kind of dealing with patients coming in and then patients going out. Whereas in home, it's really centered on the one. Do you want to speak a little bit more about that and why that's important to you two who chose to go to in-home care?
Joy, I'll pass off to you.
Sure. I do feel that as a nurse there's a great job satisfaction in home health. I feel you get to use all the tools in your toolbox. You have to be creative. We always say creativity. You have to be resourceful, and you have to look holistically at the whole patient, right? There's a reason they ended up in the hospital. We're not just fixing the part, we're actually, helping them thrive in their environment. And that takes everything that you've learned in nursing school, from care planning to, medications to, and then also the skill sets to make that happen. And I find that our nurses find that very satisfactory to see their patients thrive.
And really that ability to connect, right, with your patients.
Absolutely.
Huge advantage to have a good set of relationship building skills, because you've got to gain their trust, right? They have to know that you're there for the right reason. We're going into somebody else's home, the approach, it has to be a little bit different sometimes. And I think we get to use all of our skills that we learn in nursing school when we're standing in front of our patients in their homes.
Mm-hmm. I also want to dial back a little bit more and ask, what is it that drew, I feel like I kind of know the answer based off of what you just said, but I'd really like to go back to when you were first deciding on your career, and when you first decided to go into nursing. What was it that drew you to that career?
I think there was a lot of things for me. One was being able to, at the end of the day, feeling good about what you did, right? Mm-hmm. You know that you had an opportunity to make a difference in somebody else's life. And knowing that what we do matters, right? Not just to us, but for the people that we do it for. I can't remember ever wanting to be anything other than a nurse when I look back on it, and people laugh when I say that. And I don't really know why, other than the fact that it's fulfilling, right? That you really have an opportunity to make a difference.
Yeah. I agree. I think the job that you have as nursing can be hard, but the emotional connection with your patients, feeling at the end of the day that you've given 100% and being active in your job is lovely, right?
Not to mention also further down the road, maybe you don't think about this when you first decide to get into nursing, but there's so many different avenues, as you can see just from talking with me and Joy, that you can venture into throughout your career. Different types of facilities, different types of positions, some being management, some being operations, some being financial, some being clinical reviews. Not only just working directly with a patient one-on-one and providing that daily care, but also making a bigger impact, even from making decisions based on healthcare reform. It's endless too.
Yeah, no, I recently spoke to somebody who did medical insurance, and it's funny, the connections, right, that I'm hearing is the reason that appealed to that person was because it was a way for him to once again really help a person when they're in that time of need and advocate on their behalf.
Yes.
So just when it comes to that why, I think we have a really nice testimonial video that's like a little over a minute that I want to play, because I think it really touches at the heart of the why people would go into this career. So give me a second and I'm going to play that here.
Linda's been in the hospital numerous occasions, and almost invariably with each one of her hospitalizations, she requires after-home care. The nurses, the physical therapists, I'm not sure exactly what their titles are. We know them by their first names for the most part, and we know that when they come, it's just like having your next door neighbor come over and visit, or I would even say it's almost like having family come over and visit. So I can just concentrate on being the loving husband, and their ability to get her up and walking and moving around and doing the physical exercises with her, and being consistent with those. It's not just to come in one time and do it and then not show back up again. They're here all the time. After 13 years, we have seen the good, the bad, and the ugly. and we have now seen very, very good. We consider ourselves to be fortunate. I think we can say with absolute assurance that there is no choice but to use AccentCare.
For more information or to schedule an information visit today, contact.
So I was looking through the videos ahead of time, and that one I just think really just speaks to the why, because it really touches on how one person, a nurse in this instance, can really make a huge difference on a family that could be going through something difficult. So I want to talk a little bit more now on more the skills side of things, and actually in education as well. And I'm hoping that either of you can speak about the types of soft skills as well as some of the more technical skills that one would need to be a nurse.
I think compassion, empathy, right? Customer service, the ability to take responsibility, and want to do the right thing every day for the right reasons.
Mm-hmm. I would piggyback on that. I think a great nurse asks the why. They're very inquisitive and find out the reason that maybe someone's feeling away, or, I just feel like that's a great skill set, being resourceful. And again, of course, having some passion about what they do.
So let's talk education. What is it? So you'd mentioned an LVN and an RN. What does it take to become either, as far as the education?
Well, both pieces require a core set of educational classes. Your Englishes, your math, your chemistries, or whatever. And then each varies a little different in the clinical aspects in which you'll need to take. I do believe our LVN courses right now are about an average of, I would say, 18 months. I think most of the programs, Joy, unless, okay. And
yeah,
then
I believe, and they become a certificate, and they don't have to have an associate's degree.
Right. And then once you get up into the registered nurse, that is an associate's degree, a bachelor's degree, a master's, and then of course you can progress on to a nurse practitioner who is able to provide services much like a physician under the direct supervision of a doctor, such as writing prescriptions, seeing patients in an office without physical oversight, within a room. They do an assessment, they diagnose somewhat, and then they treat a patient at a higher level of care of what just a registered nurse does. So those would be probably the most common three levels, I would say, of nursing. Between associates and a bachelor's and a master's degree in nursing, all of those are considered registered nurses. They just might perform at different levels of care, such as education that usually need a master's for to teach, right? Maybe your bachelor's would be more likely to be found in a management position down the road. Although with an associate, we have many, many nurses that do provide some type of management oversight as they progress in their careers as well.
And I believe in most states, the bachelor's degree, they have a choice to also get their public health certificate on top of it. And then there's also certifications after having your RN that are specialties, so it's anesthesia, wound care,
Yes.
Those kind of items.
So what I'm hearing is, if you're thinking about going into this career, talk to an advisor, because it can get confusing.
It can, but here's also what I would say is you can start at whatever level you feel comfortable. And there are so many programs to continue that career and educational advancement while you're practicing as a nurse. So even if you were interested in starting at an LVN level. That doesn't mean that you have to be there at that level for forever, although it may be something that you do want to, which is great too, right? So I think that's another good thing about nursing is that your education and your opportunity for growth doesn't stop when you graduate with whatever degree you graduate with.
I also would say that nursing is wonderful in the aspect that there's a lot of opportunities in places that you want to specialize in, right? So just having that basic degree or your RN license allows you to then also find certifications or additional education on top of that into specialties, so it's really up to the person to choose what they do with their career.
Thank you so much. I want to now kind of start to think about the future. Right now, while we're dealing with COVID, there's this, we all know that there's this huge need for people to work within the medical field, but specifically nursing right now. And we it's like we didn't have the people to fill the demand throughout the world. And I'm wondering if you have any thoughts on, obviously COVID will sooner or later kind of be over or be manageable to the point where we can kind of go back to what we, an old normal or something similar. What do you think, though, that the next, say, 5 or 10 years is going to look like? Are we going to constantly have a need for nurses? Is that going to change in the future? I'll just open that up to let either of you speak on that.
I certainly don't see us not having a need for nurses in the future. And I foresee it becoming increasingly larger of a need for nurses, especially in home health, right? As we all feel, I think, that are in home health, that home health is the future of healthcare, right? Allowing people to stay in their homes, allowing them to remain as independent as possible for as long as possible, staying with their loved ones where they're comfortable, where they are able to flourish for as long as possible. So I don't see nursing going away anytime soon, for sure.
Certainly not going away.
No, I agree with Wendy. I see the trend of that we see patients in the hospital for a shorter amount of time, in the home quicker. The clinical skill set needed in the home is higher. I also see in the next 5 to 10 years, as we've seen, being proficient in the EMR and your computer, right? A lot of visits might go virtual. A lot of items are done computer. So I think that skill set will be heavily relied on.
Yeah, great. Well, that's exactly what I was hoping to hear is, we all know nursing is going to be important, but how is it changing? And so I appreciate you both touching on that point. As we wrap up, I'd love to just kind of finish with a piece of advice from both of you as individuals who've made these decisions on their career and gone through the education they need and now have a full career in it. I'm wondering if you can give one piece of advice to the generally high school age students that might be watching this and kind of considering what to do in their future. Joy, do you mind starting?
Sure. I guess my advice for people who are looking into a nurse's career is that to just be diligent and commit. That I feel like nursing school is harder than the actual job when you get out there, and to trust in yourself. I think that's the most important skill a nurse has, is trusting their instincts. And it's a great career. That's what I tell them to go for it.
Wendy?
Yeah, I agree. It's an excellent choice because you throughout your time of growing up, right, there's going to be so many different opportunities for you to be able to do in nursing. And as we grow and evolve and we change, nursing career allows you to be able to look to see what else is out there, where it fits into your life, whether it be with your family or your children, you're single or you want to travel, right? Nurses have all of those opportunities in one nice little bundle if they have that degree. What I will say, though, is going into nursing, I think that an important thing is to remember every single day that the person that you're working with could be your family member. It could be your mom. It could be your dad, your brother, your sister, whatever it is. And to treat your responsibility as a nurse. Your job is to do for them what you would hope somebody would do for you. Because at the end of the day, no matter what happens, as long as we all know that we have done that we did the best that we could, and we had compassion and understanding and patience, right? Hopefully every day you get up and you go to work, you'll enjoy what you do, and that'll make you successful, right?
Well, you're touching on that thing that we've mentioned several times here, which is empathy. You have to have the empathy and the care for others, it sounds like. So I think it's great what you both do. Thank you so much for sharing your experience and helping some of these students kind of explore the options within health careers, particularly in this case, nursing. So Joy, Wendy, thank you both so much for your time. For the students who are watching, I do want to just say we have several other health career related activities on our YouTube channel and on our website. So please feel free to check those out. We go over, you name it, we go over it, whether it's mental health or dentistry. We kind of talk about it all, as well as some of the pathways through SRJC and SSU. Okay, thank you both so much for your time.